Hello and welcome to Health Matters. I'm Vivian Irikefe. Blood is life is the fluid that carries oxygen from the lungs to the rest of the body. It carries waste to be eliminated from the body. An adult human being has between 4 to 6 liters of blood in the body, depending on size. Needless to say that blood drives human existence. Tens of thousands of pints of blood are needed every day across the world to help people. Blood transfusion is often required for surgery, car accidents, cancer, sickle cell treatment, among other emergency needs. Reports say in sub-Saharan Africa, there is shortage of safe blood for transfusion, such that the region records high rates of avoidable loss of lives. In this episode of Health Matters, we turn our searchlights on safe blood for transfusion in Africa and how to improve blood supply and consequently increase the number of people who should benefit from this life-saving procedure. Also to come in the program is the latest health news, how to keep fit and ask the doctor session. But let's begin the show with an insight on blood transfusion.
Blood transfusion therapy is an essential component in the practice of modern medicine. Blood transfusion is generally the process of receiving blood products into one's circulation intravenously. Transfusions are used in a variety of medical conditions to replace lost components of the blood. Early transfusions used whole blood, but modern medicine practice commonly uses only components of the blood, such as red blood cells, white blood cells, plasma, clotting factors, and platelets. Safe and adequate supply of blood are needed to save lives because blood is often the only means of survival. Before a transfusion can take place, the healthcare provider must make sure the blood of the donor matches the recipient. There are 4 blood types: A, B, AB, and O. Another important detail is the rhesus factor. A person is either rhesus positive or negative. Blood types must match or serious complications such as rejection can occur. This is because each blood type contains different antibodies. A technician will determine blood type by pricking the finger or drawing blood from a vein in the arm. If the blood is drawn from the arm, the technician will gently tie a rubber tube around the arm above the elbow, which helps the saved vein in your arm stand out. Then he or she will gently palpate the vein just beneath the inside of the arm below the elbow. Then a needle will be inserted into the vein and blood drawn, filling stopper tubes that are placed over the needle's access device. Approximately 6 million blood transfusions are administered to seriously ill patients in sub-Saharan Africa each year. The estimated need for life-saving transfusions in sub-Saharan Africa is put at 18 million units of safe blood per year. This 35-year-old woman was in critical need of blood caused by excessive internal bleeding during and after labor. 21 pints of blood brought her back to life.
When I had my quadruplets, I was pale and needed blood desperately. The doctor said I was bleeding profusely, and if transfusion was not done quickly, it could be fatal. My husband donated 2 pints of blood, but that was a far cry from what I needed. Blood was gotten from the blood bank, and at the end, I was transfused with 21 pints of blood because I was bleeding.
However, blood transfusion can have serious and fatal consequences if it's not practiced within the set norms and standard. Today, much of Africa lacks sources of safe blood for hospital patients in need of transfusions. Unfortunately, when blood is needed, most often it comes from a donor paid by the patient's family, if one can be found with the proper blood type in time. This is due to the lack of blood storage facilities either regional or hospital-based, to enable the collection, testing and storage of blood and blood products in advance of their need. The use of paid donors, coupled with the just-in-time manner in which blood transfusions are carried out, foster an environment where deadly viruses such as HIV, hepatitis and other blood-borne diseases are often transmitted from blood donor to patient. Although the patient's life may be saved with the transfused blood, disease may well claim his or her life in the future. Thus, for every 1,000 patients requiring a blood transfusion, around 240 people, mostly women in childbirth and children suffering from severe malaria-induced anemia, will die immediately from lack of available blood of the proper type, or later from viral infections transmitted through tainted donor blood. An adequate blood supply can only be assured through regular donations by voluntary unpaid blood donors. This man is a voluntary blood donor who has donated blood several times. He talks about his life-saving habits.
As at now, there's no technology or substitute for human blood. So the only thing for human blood is voluntary blood donation. And what we have in the country is a voluntary is replacement, and replacement is not enough. So that's why we need enough volunteers so that our hospitals can be safe and people who need the blood can get it.
Today, in few countries of the world, national blood supplies are based on close to 100% voluntary unpaid blood donations. Many countries are still dependent on family donors and even paid donors. Meanwhile, the WHO's goal is for all countries to obtain all their blood supplies from voluntary unpaid donors by the year 2020.
Every year on 14th June, countries around the world celebrate World Blood Donor Day to raise awareness on the need for safe blood and blood products and thank voluntary blood donors for their life-saving gift of blood. But what's the attitude of people to blood donation?
So have you ever donated blood before?
No,
Why?
because it's not biblical.
How do you mean?
Bible said it that you should not transfuse, you should not eat blood, you don't transfer it. So when you are transfusing blood, that means you are eating it in a ramification.
So if your wife is pregnant and you don't donate when your wife is pregnant?
And there are other blood supplements that can boost blood. Yeah. But when you donate blood, now you are eating blood. Blood goes to your body. Then when you are eating something, it goes to your body too. So at least to adapt with Bible principle, you should not donate blood.
I have not seen the necessity for it.
But do you know that you can go to any hospital and donate voluntarily?
Well, I know, but I have not done that. I have not seen the necessity for it.
They say it's good to donate blood because I'm O positive, so I donated.
Indeed, healthy blood is essential for healthy living. Blood donation, by extension, provides an opportunity to save a life, as cases of blood transfusion involve life and death. Public health experts advise Africans to cultivate a habit of voluntary donation.
Thank you, Vivian. We're glad to have you with us on the Interview with Experts segment of Health Matters. Today, we are discussing safe blood for use, the clinical use of safe blood for transfusion, and all of other things that are related to that. And at this point, I'm being joined by a hematologist and a public health scientist. He is Dr. Chukwuma Okonkwo. You're welcome to the show.
Thank you very much.
Now, let's talk about the clinical use of blood.
Well, the clinical use of blood happens to deal with the clinical aspects of blood donation, and in this aspect, it is aimed at, making unnecessary blood transfusions. I mean, the main aspect is to eliminate unnecessary blood transfusions, whereby if the person does not need it, if the gain does not, outweigh the risk, you have to drop it. You understand? Because there are so many problems you can get when you, are transfused with blood that is not safe. So the World Health Organization is trying to make sure that, unnecessary transfusions are avoided, at all levels of healthcare without compromising, standards of safety and quality. And in this aspect, what we are trying to discuss is to look at the appropriate use of blood and blood products. And in dealing with appropriate use of blood and blood products, you have to, first of all, deal with, like I said before, you check the ailment the person has. If it is something that, could be avoided or could be treated with other methodologies or other methods instead of blood transfusion, you can avoid blood transfusion. Then secondly, you look at the issue of safe blood, that the best form of blood should come from unpaid donors, people who donate blood willingly, you understand, without looking for gratifications. We call them non-remunerated donors. They are the best form of donors, for blood transfusion or blood donation. Then you look at adequate testing of that blood. How is it tested? Bloods are, of course, collected in the blood bank, must be stored adequately, and every form of transfusion transmissible diseases must be tested. For example, HIV, hepatitis B, hepatitis C, syphilis, malaria, and Chagas disease. These are things that should be screened out of those blood. Without, if you don't do that, you end up allowing the recipient to, assimilate those diseases, which will not augur, well. Then another aspect you need to talk about when you talk about issue of clinical blood use is a fact like anemia. Do you understand what I'm saying? There is the need for early diagnosis of anemia, so that if it is diagnosed early, it can be treated without, resorting to blood transfusion. Of course, we know that we are in the, sub-Saharan Africa, third world country, whereby you have, serious cases of anemia, our children, anemia within our pregnant mothers. You understand? So that's why we are highly involved, we in Nigeria. So if there is a way to avoid it, you can avoid it by early detection of anemia. Once you detect it early, it can be handled without necessarily resorting to blood.
Okay, what is the internationally acceptable standard for blood donation?
From international standard points of view, we are talking about the codes, ethics, within that blood transfusion. It goes, from safe blood, you understand what I'm saying, making sure that the blood you give is safe. That the blood you give should come from non-remunerated donors. When you talk about non-remunerated donors, like I said before, they are donors who don't care about what you are going to give them. They don't care about your payment in both cash or kind, but they give this thing, they give blood to save life. They give it because they want to give. That's one. Then, two, you have to make sure the donor in question should understand the risk of giving blood that is infected, with transfusion transmissible diseases. You understand? I've already highlighted them before: HIV, hepatitis B, hepatitis C, syphilis, Chagas disease, and the rest of them. Then again, there is this rule that in blood donation, you don't talk about any form of discrimination. There is nothing like gender. There is nothing like nationality and things. Should be kept out of it. And both the recipient and the donor shouldn't think about that. While undergoing process of blood donation. or even blood transfusion.
All right, thank you very much. I've been speaking with a public health scientist and an hematologist, and he's been talking about safe blood for use, even centering around sub-Saharan Africa. He's talked about the fact that people should donate blood voluntarily and not wait until they are remunerated before they actually go ahead to donate blood. So consider that as a thought. Have you donated blood this year? Try and do so. Thank you very much for joining us on the show.
Coming up after the break is the health news, fitness, and Ask the Doctor. Stay with us. Welcome back to Health Matters. Up next is the health news.
The Malawi Health Ministry has revealed that rotavirus vaccine introduced by the government will protect Malawi's children against the primary cause of severe and fatal diarrhea, responsible for approximately 11% of deaths in children under 5 years of age. The head of Disease Control Department in Malawi, Dr. Seth Berkeley, said the rotavirus immunization is the best hope for protection against rotavirus disease and the deadly dehydrating diarrhea that results from it. Malawi is the latest in a growing number of African countries to introduce rotavirus vaccine into its national immunization program, offering its children the best possible protection against the primary cause of severe and fatal diarrhea. South Africa has recorded a 63% decline in new HIV infections amongst children. According to a report by the UNAIDS, the country has shown tremendous progress in reducing the numbers of children and women acquiring HIV infection and in providing access to HIV treatment to both groups. According to UNAIDS, the HIV transmission rate from mother to child in South Africa for 2012 was 5%. It was 6% in 2011, 7% in 2010, and 14% in 2009. The number of women acquiring HIV infection between the ages of 15 to 49 in 2012 was 150,000. In 2011, it was 200,000. In 2010 and 2009, it was 210,000. 7 countries in sub-Saharan Africa, Botswana, Ethiopia, Ghana, Malawi, Namibia, South Africa, and Zambia have reduced new HIV infections amongst children by 50% since 2009. All health facilities that are not well equipped with both medical equipment and medical personnel in the Commercial Nerve Center of Nigeria, Lagos State, will henceforth be shut down. The State Special Advisor on Public Health, Dr. Yewande Adesina, issued a threat at a meeting with the executives of the State Health Facility Monitoring and Accreditation Agency, HEFAMA. Dr. Adesina noted that the state is working hard to ensure that citizens enjoy standard health care delivery at all times.
HEFAMA is being seen as a witch hunting association or agency, and that is so far from what this should be. It should not be any kind of a punitive system. It is a developmental system. It is a system that's supposed to help our facilities better their provision of service. If I come to you as a farmer and I find something wrong, I'm supposed to educate you about that thing so that you can provide it in a better way. And once I've educated you, I give you a time frame to make an improvement on it. So the next time I come, you will be sanctioned.
Other executives of HEFAMA promised to ensure that all hospitals keep to the standards in order to improve the lives of people. HEFAMA was set up by Health Sector Reform Law in 2006 to ensure improvement in the quality and efficiency of healthcare delivery in Lagos State, thereby securing the safety of its citizenry.
Physical exercise is a basic requirement for healthy living. It's time for Fitness on Health Matters.
Every time I work out, I always feel very good. I feel lighter. Of course, you know you're working out all the bad stuff in you. I do this every day, 5 times a week. So Monday to Friday, then I relax on the weekends. Well, what I would say is actually myself, I'm postpartum, sometimes I just had a baby. So really, I can't even do as vigorous as much as I like to do. This is just like, I would like to encourage people. Most people think, well, because I'm also breastfeeding exclusively, so you can imagine. But I have to put in some workout or else it'll be really terrible by the time I say, okay, I'm ready to start and all that. So I'll just advise people, especially when you just had a baby as well, you can take it easy. What I'm doing is called, it's basic cardio. As you can see, I'm out of breath. It's just work out to keep your heart pumping, of course, keep you fit. You may not lose all the weight you want here, but you're going to be healthy and you'll be fit.
Exercise is very good to your health, make you live long, give you strength, stamina, increase your metabolism, and then make you fit. That's the most thing, make you fit. People do maybe due to their health. Some people do exercise maybe, as in some people like maybe they don't see doctor, so they don't do exercise because doctor do advise some that okay, try to do exercise, try to do something that will make you live long, try to do something that will make you keep fit, something that will make you have stamina. But some people do it willingly just to keep them fit. But why some are so lazy? Try to do exercise. Try to make your body, as in, you should tone the body, tone your muscle.
Let's join Dr. Njembi in our question and answer session.
Endocrinologically, high TSH level, you're talking about the thyroid stimulating hormone level being high if it affects pregnancy. In a way, it's cool because if you have a high thyroid stimulating hormone, it will also lead to levels of thyroxine, which might be low or high. And if you suffer from low thyroxine level, it means that you have some other problems that can affect ovulation and conception. And you have a high TSH as well. Either way, it could also indirectly affect the other hormonal systems. To use steroids to gain weight is not safe because when you use steroids, many other components of the body also have changes, and the weight gain may not be proportional because steroids will tend to retain fluid in your body, which may be deleterious to other parts of the body. So steroids are not the best to use in gaining weight. Steroids might also increase the muscle mass, depending on what kind of weight you want to gain. If you're a weightlifter or an athlete and you're taking steroids, that's performance-enhancing drug, maybe to stimulate the growth of the muscles or increase your activity. However, if you take steroids and you gain weight, it's deleterious to the system. Anything done in moderation while you are pregnant is acceptable. However, if you are binging or you take a lot of alcohol while you are pregnant, you might develop what we call fetal alcohol syndrome in children or in babies, so that the baby develops problems. It can lead to low birth weight, premature birth, etc. However, if you take alcohol moderately, in moderation, 1 glass of wine once in a while may not be that deleterious to the baby or the pregnancy. But generally, if you can cut off alcohol while pregnant, it's all the better.
For comments and all your health-related concerns, write to us at healthmatters@tvcontinental.tv. That's the program for today. Join us next time. I'm Vivian Irikefe. Stay healthy.